Afternoon, everyone. My name is Leslie Dock, and I am the chair of Protect Our Care, an organization dedicated to protecting and strengthening healthcare for all Americans. We're joined today by Speaker of the House, Nancy Pelosi, Majority Leader of the Senate, Chuck Schumer, and Himali Patel, a small business owner from Georgia. When our speakers have finished their remarks, we'll open the call up to questions from those reporters who've joined us. Today is the 11th anniversary of the Affordable Care Act. And thanks to the ACA, over 20 million Americans have health insurance, and 135 million Americans with pre-existing conditions are protected. And the Act did so much more. Today is also just a few weeks since the passage of the American Rescue Plan. That is the most important expansion of healthcare since the Affordable Care Act. It reduced costs and increased coverage for millions and invested in ending racial disparities. And in the upcoming months, there's still unfinished business within our reach, including reducing the price of drugs, making permanent the premium reductions of the rescue plan, making more progress on racial inequities, and being sure that those who should be covered by Medicaid expansion get covered. Every Republican in the US Congress voted against the rescue plan, and Republicans have tried to repeal the ACA over 60 times. Despite the fact that vast majorities of Republicans, independents, and Democrats support what those laws did. And these majorities are true whether these voters live in red states or blue states, in cities or in rural America. Healthcare is a bipartisan issue across every kitchen table everywhere in this country, except unfortunately amongst Republicans in Washington and in the capitals of states like Texas, Florida, and Georgia, where Republican elected officials simply refuse to do the right thing. All of the progress I've described over the last decade has been possible because of the leadership and courage of House Speaker Nancy Pelosi, now Majority Leader Chuck Schumer, a Democratic House of Representatives, and a Democratic Senate, and the leadership of two Democratic presidents, Barack Obama and Joe Biden. All of this work has been about helping people one at a time across America by making quality health insurance affordable for tens of millions of Americans who otherwise couldn't afford it, and by protecting people with pre-existing conditions. So it's important that we begin our program today with Himali Patel, a small business owner from Georgia, whose businesses were dramatically affected by the pandemic, who has pre-existing conditions and has been relying on the ACA for her health insurance. Himali, we look forward to hearing from you.
Thank you, Leslie, Speaker Pelosi, and Majority Leader Schumer for having me here today. My name is Himali Patel, and I'm a small business owner here in Metro Atlanta area. For the past 11 years, the Affordable Care Act has been a tremendous lifeline for me because I've lived for the last decade and then some with several pre-existing medical conditions that range across the spectrum of autoimmune illnesses. And President Biden signing in the American Rescue Plan has given me new hope this upcoming year. Before the pandemic hit, my brother and I had 5 businesses with several employees. Then came COVID. Now we're down to one, just a measly little dry cleaning business, and we barely see enough customers. And it's very difficult while we're in COVID because people are wearing the same exact shirt to every single Zoom meeting. There's no need to go ahead and get something dry cleaned. As a result, my pre-existing conditions would have made getting healthcare insurance difficult before the Affordable Care Act. And with the American Rescue Plan, getting the coverage that I need through the Affordable Care Act is going to be even less expensive than it was before. My premiums are going down to almost zero, which is fabulous news and much welcome help. Along with the economic stimulus in the American Rescue Plan, it should help me go ahead and jumpstart my economy and help me and others like me to reopen my business and still focus on my health, because at the end of the day, health is wealth, and I won't be able to operate a business if I'm not healthy. I'm just grateful that there finally is some plan in place and leadership that's going to be working to get us back to normal. I cannot thank our leaders across this nation for doing their part and helping citizens like me. Thank you, Leslie.
Thank you, and thank you for sharing your story. It's so important, and it is exactly what this law was meant to do, and exactly what the speaker and Leader Schumer and others have been saying that we can't fix this economy until we get our health back, and we can't maintain this economy without affordable health insurance and good health care for everyone. So with that, let me just turn this over to Speaker Pelosi, who, as I said before, is the person we have the most to thank for the smiles we can wear on our faces about healthcare this year compared to years before. So, Madam Speaker.
Thank you very much, Leslie, for bringing us together to observe, indeed to celebrate the 11th anniversary of the passage of the Affordable Care Act. It is completely appropriate that we have a very important person with us, Ms. Patel. She is the reason, Hamali is the reason that we passed the bill. And she and others like her under the leadership of the Protect Our Care is the reason that we were able to save the Affordable Care Act. We could do all the inside maneuvering that we could legislatively under the inspired leadership of President Barack Obama and Vice President Joe Biden. But the inside maneuvering doesn't add up to the great success without the outside mobilization. So I'm here as we celebrate to thank Protect Our Care, you, Leslie, Brad Woodhouse, and so many others for making the outside mobilization the force that it was to get us across the finish line. And that, what saved it even since its passage were the stories. The stories, Hamali tells her stories, but 10,000 events were held for people to tell their stories. Nothing more eloquent to a member of Congress than the voice of his or her own constituents. And so as we celebrate, we want to improve, and that is exactly what we have been doing. Thank you for acknowledging what is in the rescue package that makes the subsidies available to many more people in our country. As we transition, we'll have our little growing pains, but we can, that's a sign of success as we grow. And then we have the road ahead to look at other considerations in terms of the cost of prescription drugs, et cetera, as we go forward. But for now, to acknowledge that on that day, 11 years ago, 20 million more people had access to healthcare. 150 million families in our country who already had healthcare had improved benefits. No longer could they be held back from getting care and insurance because of a pre-existing medical condition. You know some of the provisions that relate to children 26 and under. You know that being a woman is no longer pre-existing medical condition. The list goes on and on. The expansion of Medicaid, a very important part of it, and we hope that across the country, many more governors will see the light as to what this means. Reverend Martin Luther King, he said of all of the inequalities that exist, the most inhuman was the inequality related to healthcare, because people could die, and people did. And we have saved lives, and now we'll save more for what's in the rescue package and as we prepare to go forward. We see this as a pillar of economic and health security for our country, on a par with what happened, Social Security, Medicare, Medicaid, the Affordable Care Act, and now this rescue package. As with the other initiatives, were always improved over time. We'll improve that and prepare us for how we make some of these improvements permanent. I'm very proud of Congresswoman Underwood of Illinois, whose legislation was to make these subsidies available at a higher level of income so that many more people would have affordable quality health care. Remember, it was called patient protection, affordable health care. Joe Biden was there present at the birth. He's now president as we grow it, and we thank President Obama for his tremendous leadership. And I thank the members of Congress who had the courage to not only help create, but to support the legislation they're all celebrating today. I thank you again, Protect Our Care.
Thank you, Madam Speaker. And we had an opportunity to be on a Zoom this morning with new Secretary of HHS, your former colleague, and he's just raring to go and is going to do a great job and is already on the road talking to folks and listening.
He really did a job as Attorney General defending the Affordable Care Act against the assaults on it. It's hard, but what's interesting is that many more people are accepting it. When it was passed, it was new. People were given misinformation about it, and so not as many people signed up as we would have liked in the beginning. Well, many did, but we didn't reach some of these governors who didn't expand Medicare and Medicaid. And then as people enjoyed it, benefited from it, it grew. But there were still assaults on it, and Javier Becerra, as Attorney General, defended it with other attorneys general, and now as Secretary of HHS with President Biden as the commander-in-chief of our fight for quality, affordable health care for all Americans. I see we've been joined by the distinguished Majority Leader. Doesn't that have a nice ring to it? Majority Leader Schumer. I yield back to Leslie to introduce.
Majority Leader, we're so happy you're here. We've had a chance to talk to Hamali Patel from Georgia, who's told us about the impact that the ACA has had on her, and also the impact that the rescue plan has had on her and her businesses and her health, and of course the speaker. So we're here today to celebrate and to talk about where we've been and where we might be able to go, and to thank you, Senator Schumer, for all your leadership. So with that, please take the mic.
Let me give some kudos to you, Leslie. You've been indefatigable on this issue from when I first met you in the 90s, and you're one of the main reasons so many more people have health care. And of course, I want to take off my hat to Speaker Pelosi. I don't think anyone, any elected official, worked harder to get this done than this fine speaker. So let me thank her as well. And I'm excited, to celebrate this great anniversary, how far our healthcare laws come, and the healthcare expansion. I'm sure Nancy has outlined it. We fought for in the American Rescue Plan. It's been quite a journey, but all those who predicted the demise of the ACA, that it would be a flop substantively, that it would be a flop politically, are absolutely wrong. ACA is better, stronger, wider, bigger than ever. And we all know what's happened. When you don't have health care, it's a nightmare in your life. A nightmare when you're healthy because you worry, and a nightmare, of course, when you're ill. But now millions of Americans have gained access to health care, and amazingly, 135 million Americans who have pre-existing conditions, asthma, diabetes, cancer, can't be denied coverage or dropped by their insurance companies. So this has been life and death for millions of people. They don't know who they are, and we don't know who they are. But there are millions of people walking the street who would not be on this earth if not for ACA. I'd like to talk about someone in my state, New York, Penny Fryman. She's from West Hempstead on Long Island. She was born with a neurological disorder. She was bound to a wheelchair attached to a feeding tube. And she and her family know without ACA, she wouldn't be here. 500,000, and with 500,000 lives lost to COVID in the last year, and millions more dealing with the side effects, the horrible side effects, which we hear all the time of this evil virus. It's even more critical we have to fight people with pre-existing conditions, because now there's a whole new pre-existing condition that millions of Americans have. So that's why Democrats feel so strongly that we have to build on the foundation of ACA with ARP, the American Rescue Plan. It includes the most significant healthcare expansions in a decade. Expanding coverage, lowering costs, improves the ACA's premium subsidies by increasing their value and allowing middle-class Americans to receive them as well. Under the ARP, a family of 4 earning $75,000 has their premiums cut in half. And an individual making $18,000 sees their premiums drop to 0. There's also $15 billion in incentives for the non-expansion states. This is particularly important to us in the Senate in Georgia, where a non-expansion state, where this was a big issue in the campaign. This is one of the 3 or 4 top issues that helped us take back the Senate. So we feel an obligation to make sure it happened. We all know the Republicans keep trying to kill the ACA. They don't get it. They don't see how much the public likes it. I think they've tried 70 times, but we're alive and well, and their efforts to kill it fail. and now it's even better. Trump campaigned against ACA and he wanted to eliminate it. President Biden, our ally, is wasting no time in reversing all these bad Trump measures. So there's more work to do, but we can proudly say not only is ACA alive and well, but it's bigger and better than ever. I look forward to working with the Speaker, with you, Leslie, and with all Americans to continue that positive movement as we go forward.
No, thank you so much. And we were saying before that it's just nice to be able to talk about healthcare with a big smile on our faces, because that wasn't always so true in the years past. So thank you again, Majority Leader, for all of your work.
I'm going to have to get back on my other Zoom. I went from a Zoom to this Zoom and I'm Zooming back to the other Zoom.
All right.
Thanks for having me. Take care.
Thank you. Madam Speaker, can you stay a few minutes for questions?
Of course.
Thank you. Okay, Mitch, will you get us started?
Sure thing. So for all of our reporters on the line, you can see a little raise hand button that you can virtually raise your hand with if you have a question for Speaker Pelosi or Hamali. So if you want to go ahead and do that now, we can get started.
And we're hoping folks can stick to healthcare, so if you can.
Okay, so our first question is going to be from Ariel Hart at the Atlanta Journal-Constitution. And Ariel, you should be live.
Hi, can you hear me?
Yes, we can.
Great. So question from here in Georgia. Looks as if Ms. Patel has an income that qualifies for her for significant subsidies. The 4 times federal poverty rate here, though, ends at about median income for Georgia, median household income. So, Speaker, what would you say? What would you say to those Georgians who don't qualify for subsidies at all and are about middle class and are paying the full freight of premiums and several $1,000 deductibles?
Well, I would say that we are expanding. We wanted to do this at the first bill, to have a higher a plateau, a threshold, I should say, at which people could receive subsidies. That we had to pay. We paid for the bill, so we stayed within what fit within that pay for. So now we have the opportunity to expand that. Our goal is to have affordable health care for all Americans, not just by adjusting a subsidy level, but by expanding it across the board. And that is some of what we will do as we go forward. And part of that is the cost of prescription drugs. There's nothing that increases the cost of healthcare more than the cost of prescription drugs. And we have HR 3 that Elijah Cummings cut drug costs now legislation that will help reduce the cost as well. So there are all kinds of ways to reduce the cost to a family. Part of it is what they have to pay. At most families in this range don't have to pay more than $10 a month. And then if we reduce the cost of prescription drugs, of course, that is a reduction for all families as well. So it's quite remarkable what was done in the rescue package. Is it all of it? No. We still want to put many more people in the enhanced Medicaid. That isn't folks that you're talking about there. But I would just say that this is constantly improving, and all of them benefit from the benefits of the Affordable Care Act. If they have a pre-existing condition, if they have a child 26 or under, if they're a woman, and the rest. But understand this: this is coronavirus centric. We're doing this. We need to make these permanent. And as we make these permanent, we can try to expand them further for the families that you suggested. Because again, as Dr. King said, this is the most inhuman because people can die.
Thank you, Madam Speaker. And as you said, the rescue package, depending on which estimate you look at, there are up to 25 million Americans, whether it's through Medicaid or through the affordability provisions that will now have an opportunity to become insured at affordable prices that they couldn't before. And so that the bill is not just about more people getting covered, it's about easing the economic burden. And that was your design from the very beginning. Mitch, any other questions?
We do. Our next question is going to come from Christina Peterson at the Wall Street Journal. Christina, you should be live.
Great, thank you. Speaker Pelosi, as we look forward to the next major legislative package, including infrastructure, would you consider including healthcare changes to that package? And if so, what might you be open to?
Well, I think that what is in the public domain as to what is being discussed, and I thank you for your question, is this is an infrastructure bill, and we consider human infrastructure a very important part of how we go forward. We include education and housing in addition to roads and bridges, et cetera. We also have a big broadband provision in there for distance learning and all different other ways that we enhance people's well-being. Okay, so to your exact question, one of the considerations that members are discussing is whether we have aspects of HR 3, as I mentioned, the Elijah Cummings lower drug cost now legislation. If we were able to do that, we could save almost $500 billion, almost like $450 billion that could be used to help improve, as the previous question, improve the affordability and the access, because accessibility and affordability are one and the same in our view. So that is one thing that we would consider. Now, would it also pay for other aspects? Community health centers are very much a priority for us in leadership of Jim Clyburn, our distinguished Democratic, with Mr. Pallone, the chair of the committee. They have a plan for broadband expansion, but also community health centers. This is, I would carpet the country with community health centers, and much of that funding can come from the money that we would save by passing HR 3. So those are the considerations that we have to make. Now, we want the bill to be bipartisan, and usually infrastructure has not been partisan, and so to the extent we have to make decisions as we go along, but we would be missing an opportunity if we did not include lowering the cost of prescription drugs. Going back to 2006, when we ran and won the House back, we had 6 for 2006. 6 things we would do in the first 100 hours. 5 of them became law. 1 of them did not. It passed the House, of course. It did not get 60 votes in the Senate, and that was enabling the Secretary of HHS to negotiate for lower prices. We just couldn't get it past 60 votes. Okay. Then fast forward to the election of 2016, the presidential candidate on the other side, he said, I'm going to negotiate like crazy to get those prices down. President to-be Trump, candidate Trump, I'm going to negotiate like crazy. But then he sort of abandoned that when he became president. Well, we're going to negotiate sanely in order to make sure we can reduce the cost of prescription drugs. I have seen grown men cry across the country as we've gone around and traveled when we could about this. When we hear of the story, well, Ms. Patel's story is one that is affected by the cost of prescription drugs as well. So this is really, it's been a priority of ours for a very long time. We couldn't, as I say, get it in 2007 in that January. President Trump spoke about it, but then ignored it, just as he did with the infrastructure, but not to go into that. We want this to be as bipartisan as possible, but we don't want bipartisanship to limit what it does for America's working families, for small businesses, for our children, for our country.
And if I could just ask one follow-up, is expanding Medicare eligibility something that might also be considered in this package?
Excuse me, I'm sorry?
Is expanding Medicare eligibility something that you might also consider including in the package?
Well, there are all kinds of initiatives. In other words, this bill that's coming up, the recovery package, is not the last day that we will be discussing all of this. So our goal is affordable healthcare for all Americans, affordable quality healthcare for all Americans. Expanding Medicaid is essential to that. And I understand that even some governors in some red states are thinking more about that, because that's one of their biggest expenses in the state, and we were willing to help with that. But it is obviously it is something that we want to do. I want a public option. I don't know that we get that in this bill, but this is an ongoing conversation of improvements, of advances that we can make as we celebrate the Affordable Care Act. I wanted public option 11 years ago. I didn't succeed then. We had it in the House. We couldn't get it in the Senate. We'll see where we go from here. But everything is on the table. Let me just put it that way. Everything is on the table. We have to be agnostic about the choices we make. What is it that does the most for the American people at the least cost to them, making it accessible and affordable, and to do so in a way that makes it's not about just healthcare in America. It's about the good health of the American people. And that goes beyond, shall we say, the doctor's office. It's about housing, and it's about clean air and clean water and all of the other aspects of the well-being of the American people. So we see the strength of our country, not only in our military might, but in the health and well-being of the American people.
Thank you, Madam Speaker. And just in looking at the clock, we promised you we'd let you get on to the nation's business. Thank you for doing this. Thank you for all that you've done. Thanks to everyone who's participated. Hamali, thank you for taking the time to be with us, tell your story. And I hope people get back to work and your business gets back to work too. Thanks, everybody.
Just join you in thanking you, Molly. I do say all the time, there's nothing more optimistic a person can do or courageous than to start a small business, maybe getting married, but just and so I thank you for your courage, and I thank you for your generosity of spirit to share your story with us. And we hope that the improvements that are there, you will feel the effect of them soon. And I join the leader in thanking Leslie for his personal commitment to the good health of the American people and to protect our care, for bringing so many people together as we go forward. Everything on the table in order to do the best possible job to keep our country in the forefront. Thank you so much, Leslie. Thank you.
Thank you.
And
Thank you.
Thank you.
Bye-bye. Bye-bye.